All right, so my name is Emily. I'm one of the medical students that goes here to the University of Iowa. Today I'll kind of talk about what a cardiologist does, what they are, and like I mentioned before, kind of go through some scenarios of patient presentations and see what you guys kind of think. And we'll talk about heart attacks and how to treat that and all that fun stuff. And if you guys have any questions along the way, you guys don't have to raise your hand, just go ahead and ask them. And I'll try to keep looking at the chat to make sure, see if there's any questions or anything, but just feel free to unmute yourself and ask any questions. I don't mind at all. Let me share my screen. Whoops. Okay. Go back. Can you guys see that okay? Perfect. Okay. All right. So what do you guys think a cardiologist does?
They treat the heart.
Yep, good job.
Whole cardiovascular system.
Yep, good job.
They study how the heart works.
Very good, very good. Yeah, so they specialize in the study or treatment of heart diseases and heart abnormalities.
And your atria and things like that.
Yep, very good, very good. So how do you become a cardiologist? It's a lot of work, but if you love it, then it isn't work for you. But after you go to college for 4 years, you do medical school like I'm doing for 4 years. And then after that, once you become a doctor, you have to do more training through what's called a residency. And for a cardiologist, that's 3 years. And then after this residency, to be an expert in the field of all things heart, how they work, what happens when something goes wrong, you have to do 3 to 4 years of more education in what's called a fellowship. So as you can see, many, many years it takes to become a cardiologist, which is important because the heart's very important and there's a lot of things that can happen with it.
Are you done with it or are you in one of those stages?
So right now I am a medical student. So I have 1 more year until I become a doctor and then I'll do my training. But I'm not going to become a cardiologist. It's just something that I am interested in. So good question. Yeah, like somebody mentioned in the track, even like what's called neurosurgery, that's a very long time. So certain fields require more years of training and more years of practice than other fields. Okay, so some of the things that cardiologists do. So one of the main things that, since the heart is a pump that runs on electricity, we're able to see the electricity going through a heart on what's called an EKG or an electrocardiogram. And so we're able to see the different electrical conduction system of the heart. And we're able to see, okay, is the electrical circuit in this heart working okay? Or is there something in the heart that's kind of blocking the circuitry that's going wrong? So that's a part of cardiology that they do. And another cool thing, which we'll deep dive into and kind of talk about more, is procedures that cardiologists do. And we'll kind of talk about, you know, what happens when you have a heart attack. Well, this is one of the things that they can do, so that they can go up through your leg or through your wrist. And I'll have a better picture, but they can take pictures of your heart and all your heart vessels and stuff and see what's going on with your heart. And we'll talk about that more later on. But these are just one of the things that cardiologists do. They do way more. There's more specialties within cardiology, but this is the general picture of what they do. And so, but one of the things that they don't do is heart surgery. They don't do surgery. That's a different pathway that you can do as a doctor, and that takes a little bit more of training, but they don't do surgery. They can do procedures like I showed you in the last slide, but this is what surgeons do. If you need to go in through the chest, that's for the surgeons. So, okay. So now we're going to kind of talk about the different parts of the heart and how they're able to pump blood throughout your body, you know, get the oxygen rich blood and the blood that doesn't have oxygen, and how all of that works. So the heart has 4 different chambers. Can anyone tell me what those 4 different chambers are called? And that's a-okay if you guys don't know.
Arteries?
Okay, so there are arteries, yes. Anyone know
Left
what
artery, right artery.
okay. I think somebody used the word atrium before. I think I
Atria,
heard
yeah,
that.
that was me.
Yep,
Left
yep,
atrium, right atrium.
yep, yep,
Atrium. Because
yep,
that's
atrium, yep, for one singular atrium. So yeah, so you have 2 atria and 2 ventricles. And so you have the left side of the heart and the right side of the heart. So you have the left atrium, which takes blood from the lungs that's nice and full of oxygen, which is why it's red. And that goes into the left ventricle, which is able to, because the ventricles are the big pumps of the heart. And so they're able to pump the blood from the left ventricle to the body. So our tissues and organs can get oxygen so they can keep going. And then the blood from the body that doesn't have any oxygen, that comes in through the right atria into the right ventricle, atrium, excuse me, into the right ventricle, where that blood that needs more oxygen can then go to your lungs, where we take a nice deep breath to fill that blood with oxygen. And so here is a more bigger diagram with more parts to it. So right here, we have things called valves, and valves are basically just like doors that the blood pushes against and it opens up the valve or the door. And then that is able to close. So that prevents blood from going backwards into the pathway. And so like I was talking about, starting from the body, the deoxygenated blood goes through your veins up into the right atrium, through that valve or through that door into the right ventricle. That pumps it up to the lungs. Take a nice deep breath, get new oxygen. Now that's going to go through the arteries into the left atrium, goes through another valve into the left ventricle. And then that left ventricle is going to pump that through another valve, and that'll be able to go through the body. And this might be a tough question, but the left side of the heart, the left ventricle, is more muscular than the right side. Why would you guys think that this is more muscular than the right side?
Maybe because the right side has to push the blood through, and then the left side doesn't really have to do that. It just has to push it out to the body, or
Okay, so
something like that. I don't know.
yeah, so you're on the right track. Like your thought, yep. So
I think the left side is more muscular than the right side because it has to carry oxygenated body blood to all of the body. It has to carry out it to all of the body, whereas the deoxygenated blood goes only to the lungs.
yes, that's exactly correct. So good job, guys, that the ventricle, the left side of the heart, has to pump to the whole body. So it needs to be stronger than the right side. So good job. So now we're going to kind of talk about one of the things that cardiologists
Why are the
do.
X's there?
Yeah, so I'll talk about that. So one of the things that cardiologists deal with is called heart failure. And so that's when part of the heart isn't pumping properly, isn't functioning properly. And so stuff gets backed up. So I'll kind of go into that. So what do you guys think happens if we were to make this valve right here that allows blood to go through to the body? What happens if we made that valve stiffer, that it couldn't open up? What do you guys think would happen?
What did you say?
So if we were to make this valve right here where my mouse is at, if we were to make that stiffer where it wouldn't open up as much, and so blood couldn't get through, what do you guys think would happen?
Blood
It would
clot.
get blocked up. Blood can't go to the body.
Mm-hmm.
It might die.
Okay.
Blood might pool up at the place, and if the valves are closed, if one valve is closed, the like suppose you're a drop of blood,
Mm-hmm.
and you're traveling through the body you serve. So and you're approaching a valve after crossing one, and suppose that valve is closed, but the other one was open, then the blood would travel backward.
Yeah.
That would cause your blood to be deoxygenated, which would cause you oxygen starvation.
Yeah, so something along the lines of that. Yeah, so if this valve is closed, the blood can't get through. So the blood is going to go backwards to where it originally was from. So if we close this valve here, all the blood's going to pool here and want to go back up to the lungs. Good job. Or if like this valve didn't work, or if this valve didn't work, then all the blood would go back to the body. So good job. So another thing too, that let's say in the case of the left ventricle, if this is harder to get open, this left ventricle is going to get more muscular. So kind of think of it as that you have a heavy box that you have to push. You know, if you have a small little kid trying to push the box, it's going to be harder. Whereas a guy who has big muscles, it's going to be easier for him. So that's what the heart tries to do, is that they try to build more muscles so it can push up against that stiff valve to get blood to the body. So yes, you will have blood backing up to where it originally came, but you'll also have changes within the heart to become more muscular to try to overcome that stiff vessel, that stiff valve. So good
Just like
job.
there's hypertrophy, is there such a thing as hypotrophy? Like where your heart gets too unmuscular.
Yeah, so that would dilate or make this part bigger. We won't really go into that, but yeah, you can have to where this gets nice and big with really thin walls. Yep, that is another type of heart failure, but that's a little too advanced, but yeah, it can. Good job. Okay, so now we kind of have kind of some scenarios for you guys. So let's say that valve was super stiff and now the blood can't get through to the body, and so it's going to go back up into the lungs. What type of symptoms, or what do you think the person would be feeling if all of that fluid stayed in the lungs?
Phlegm and like the drowning feeling.
Yeah, very good, very
Drown
good.
without
Or maybe
getting in the
atrial
water.
fibrillation.
Okay, anything else?
Maybe your blood won't be able to get to your body. It might not be oxygenated. You might not be able to like move as well with your joints or whatever. And then you'll have a feeling of drowning. Yeah, oxygen starvation.
Coughing fits, coughing up blood.
Okay. Any other thoughts?
Phlegm.
In rare cases, it might be lung cancer.
Could be. Okay. So very good ideas. Good job, guys. So yeah, so if, you know, the lungs are full of fluid, you're not going to be able to breathe, feel like you're suffocating, drowning. I think somebody said, yeah, so all that fluid is going to leak out and get shortness of breath. So here, this is an x-ray. I don't know if you guys have ever seen x-rays before, but it allows us just to see pictures of what we're taking that of. So here on the left is a person with a normal x-ray. So here's their heart right here. Looks normal. And then here are your lungs. Oops. Here are your lungs. And the reason they're black on x-rays because that represents air. So we could see that the lungs are nice. They're full of air. They're working good. Good to go. But this person here, what's wrong with this person? What's different on this one versus this one?
It looks like there's not as much air in their lungs.
Good job. And why would you say that?
Well, maybe they're being like
because there's less black
drowned in
states.
Yeah, good job. So yeah, like you were saying, less air in their lungs. It's more white,
More
right?
fluid.
Like you can't make out the pictures of the lungs. So this is probably fluid. And like you guys were saying, you know, won't be able to breathe as well and stuff. And yeah, you could get pneumonia and stuff with that. So this is a big component of heart failure, is that, you know, if that left side of the heart is not pumping right, it's going to go back up into the lungs and you'll get those symptoms. Okay. And so what about right-sided heart failure? So, you know, the right side of the heart isn't pumping as well. And so all the fluid is going to go back into the legs. What do you guys think would happen in that case? What kind of symptoms would patients have with right-sided heart failure?
Maybe weighted, feel too weighted.
Okay. Yeah.
Swelling.
Mm-hmm. Good job.
Eventually you're not gonna be able to, you might have oxygen starvation again because the blood vessels will eventually run out of oxygen
Mm-hmm.
if you can't get blood vessels more oxygen.
Yeah. Good
Your
job.
heart muscles are always hungry for oxygen. So if they
Mm-hmm.
don't have oxygen, they will eventually die of oxygen starvation. And if too many heart cells die because of oxygen starvation, that will eventually lead to heart attack
Mm-hmm.
or heart stroke.
Your limbs will start to kind of go numb because the oxygenated blood will go to the most important parts of your body. So like your heart and your brain. So slowly all your functions would start to die down because they are seen as less important than keeping your brain alive with the oxygenated blood. And your symptoms, your senses are going to start to die down because they're not necessary. You're just going to slowly die kind of into just
Like a coma?
yeah, a coma.
Yeah. Yeah. So in the cases of, yeah, if there's not enough oxygen going around the body, yeah, it definitely does go to what the body deems as more important organs. So the heart, definitely the brain is like the most important. But yeah, get that. But the main thing with this is that, you know, with right-sided heart failure, you know, something isn't working properly on the right side of the heart. So all the blood is going to cool back into the legs. So like somebody said, you'll get swelling. And that's what this is. We have a fancy word for that. That's called edema, which is just swelling in the legs. And so with this, if you were to press on the legs, it would actually leave like an indentation into the legs. And that's how we know it's edema. And so that this is a very clear indicated. Yep, edema is just a fancy word for swelling.
Can you spell it out?
edema, edema.
Okay.
Yep. So yeah, with heart failure, you know, if it's the left side, it's mainly going to be difficulty breathing. And then on the right side, it's going to be backflow into the legs and stuff. And heart failure is normally a long course, you know, it's not sudden. It takes a long time for this to happen, you know, because the heart is able to compensate, you know, make more muscle to be able to push against those stiff valves and stuff. So this heart failure takes a while to develop. Okay. So now we're going to kind of get into a different topic of what cardiologists do. And that's, you know, what happens with the blood supply to the heart and what happens in cases of heart attack. And so, you know, the heart's pumping, it too needs oxygen. So how would you get oxygen to the heart? Well, you know, with the left ventricle, it has all that oxygenated blood. It's going to pump up through that valve that we talked about, the aortic valve, go into the biggest blood vessel in your body, which is the aorta, this big guy here, that supplies it to your body. But then off of the aorta, we have these two little arteries right here. Those are called coronary arteries. And basically when your heart pumps and it has all that oxygenated blood, those coronary arteries will take some of that oxygenated blood to feed the heart itself. So you have the left coronary artery right here, which branches out into many different other arteries. And then you have the right coronary artery right here, and that'll come down and feed mainly the right side of the heart. And these arteries will like loop around behind to the heart as well to make sure that all the tissue is fully oxygenated. So in the case of heart attacks, with heart attacks. A lot of times it's, somebody who doesn't exercise a lot, eats a lot of unhealthy food, and a lot of unhealthy food has fat and cholesterol. And that stuff in the food is really sticky to heart valves. So here we could see is fat and cholesterol, it gets stuck to the side of these heart valves. And
Does it
over
have to
time,
be,
you'll
black?
get more cholesterol and fat stuck. So what do you guys think happens when an artery gets clogged?
You get clots, and the blood flow there stops, and it needs to be like, and it needs like something to like combat it, to open the valve up again.
Yeah, very good. And you're already leading into what I'm going to talk about later. So good job. So yeah, if you have, no blood flow here because it's completely cinched off, then this part of the heart, could possibly die if there's no oxygen to it, right? And so we'll kind of talk about, how are we going to fix this problem? But very good job. Okay. So what do you think if that part of the heart doesn't have any oxygen, somebody's having a heart attack, what kind of symptoms, what do you think that person would be feeling when they're having a heart attack? What do you guys think?
Shortness of breath,
Mhm.
striking pains, suffocating feeling, and
And
kind of
oxygen
that like
starvation.
plastic, like clenching their heart, kind of falling down.
Yeah. Anything else?
Oxygen starvation.
Yeah.
And and you feel some sort of pain in your left side because on the left side of your body, like the left half, because the heart is a little to your left, not the right.
Yeah. You could get pain elsewhere, but yep.
Numbness, and then sometimes sometimes it'd be sudden, or sometimes it'd be like kind of spread out. So yeah.
Yeah. And you make a good point too, is that most of heart attacks are very sudden. Come on all of a sudden with all the symptoms that you guys have been talking about. So good job. So, you guys talked about, having that pain in the heart. Some people describe it as like an elephant sitting on their chest, that it's super heavy. Shortness of breath, you guys described. You can also get, pain that goes up to your jaw, to your neck, behind your back. You can feel super nauseous. You may vomit. Those are all what we call classic symptoms of heart attacks. And a thing that I want to point out to you guys is that not everybody experiences things the same, right? Everyone has different experiences because everyone's unique, right? And in girls, they can have different symptoms when they're having a heart attack. They may not come in with, I have this pain in my chest, I can't breathe, I feel nauseous, my pain's going up to my jaw, down my arm, the classic symptoms that we think of. Women may come in and they may be like, I feel like I have heartburn, I am extremely tired, something's not right. So just something to keep in mind, that if you guys ever become a doctor and somebody's coming in with symptoms, just because they're not having that shortness of breath or chest pain doesn't mean that they're not having a heart attack. So there can be a wide array of symptoms that somebody may have when they're having a heart attack. So, but most people will present with the things that you normally think of and the things that you guys have talked about. So good job. Does anyone have any questions so far? I know we covered a lot, talked about some big topics. Anyone have any questions or comments or anything before I kind of talk about these patients? Okay, so we have patient number 1. Oh, somebody in the chat. Okay, patient number 1. So they come into your clinic after eating a big Thanksgiving dinner. They're complaining of some chest pain and some shortness of breath. And it's gradually worsened over 4 days. Wasn't sudden, just getting worse and worse as the days go on. I think there's more hints. And so when you take a look at this patient when you do their physical exam. You notice that their feet are super swollen. And when you listen to their heart, their lungs, it doesn't sound clear. It sounds kind of gunky and that there's stuff in it.
I think
So
I know what it is.
what do you guys think it is?
Heart failure.
Mm-hmm.
Maybe a heart
Because
attack.
I
Okay.
think heart failure because it's gradual. It's not sudden.
Heart failure, like kind of mostly because of that swelling, but heart attack's still on the table because they don't always happen suddenly.
Okay. Yeah. Why? This is kind of a tricky question. My friend wrote this question, but why do you think Thanksgiving would play into it?
Because actually, usually in Thanksgiving, you have things like pumpkin pie and sweet potatoes.
Okay.
Because because a lot of Thanksgiving foods have a lot of fat in them, and so when you combine like all those fatty foods with
Mhm.
the overeating, the buildup of fat in your arteries doesn't always happen like over a lifetime of eating. It can sometimes happen suddenly also.
Yeah.
So all the buildup of fat from the Thanksgiving dinner could lead to the heart failure or heart attack.
Good. So normally with heart attacks is that even though you may consume a lot of fatty foods at once, it does take a little bit longer for that fat to accumulate in your arteries. But with Thanksgiving, you eat a lot of salty food. And with the salt, that can worsen heart failure because the salt drags in water. So it just makes all that edema, like we talked about, worse. So this person, he or she does have heart failure. Okay. So with patient number 2, they come in, they have high blood pressure, hypertension, and they have high cholesterol. So the high cholesterol, high fatty stuff in their blood is circulating. They come with chest pressure and significant shortness of breath. Their symptoms began 2 hours ago. So all of a sudden, I think I have more hints. They're also really nauseous and their lungs are clear. It's not gunky, nothing. What do you guys think? Heart attack or heart failure?
Right now, I'm thinking heart attack.
Mm-hmm.
Heart attack.
Maybe
Yep.
maybe heart attack.
Okay, good job. It is a heart attack because, they're all of a sudden the chest pressure and the high cholesterol puts you at risk for heart attack. And how would you guys treat it? How would you treat a heart attack?
Maybe surgery, remove the clot that caused the heart attack.
Yeah, so you can do surgery, which the surgeons would do. What do you think a cardiologist would do in this case?
Well, isn't there
We
some
send
kind
them
of
to the
machine
surgeons.
that can like pump air and like other blood or whatever for the person?
Or they use a machine to look for the clot in the heart, because usually in heart attacks there are clots that cause it.
Yep. So a machine where it would pump the blood for you, that's sometimes used in heart surgeries.
Dialysis.
So with this, it was a picture that I showed a while back ago, but what cardiologists can do is that they can go through your wrist or go up through your leg with a little catheter, which has this balloon on it and this wire stent.
Oh yeah,
And
they look at the pictures, right?
Yep, exactly. Let me see. I think the next slide is a picture. Yeah, so they're able to take this stent and they're able to go through the coronary arteries like we talked about. And they're able with this catheter to shoot dye into the coronary arteries. And then with this, they're able to shoot dye, look through the coronary arteries. Oh, this one's open, that's fine. This one's open, that's fine. Uh-oh, this one is blocked. So they're able to put this stent in that blocked area and open that part of the coronary artery so that the blood can flow. So that's how cardiologists would fix a heart attack with that, is take pictures of it, see where that blockage is at, put that balloon and that stent in there and it's open, and they can hopefully save that part of the heart tissue.
Okay, we've got like 30 seconds, by the way.
Okay.